So we're waiting on an update from the Minister of Health based on what we were asking for. And unfortunately, we also had to write a letter last week to the College of Nurses of Ontario. We filed a complaint more than a year ago, the 12th of November 2024, in regards to some of the nurses who were on the night that we were in the hospital waiting.
Right.
And that process has been so frustrating. I'm using that word, but it doesn't even feel like that really explains how stressful it has been, where, you put a complaint in, and this is not a complaint for somebody was rude or,
Right.
just having a moan for the sake of it. This is a complaint because we sat in that ER and vitals were taken, showing a deterioration, and nothing was done. And it resulted in the death of our child. So the most serious thing that could possibly happen when you go to an ER, when you take your child to a hospital. And what has ensued has been a year of very bad communication, not proactive. Typically, it will take about 6 months to do a thorough investigation into a complaint. And we accepted that up front because we wanted it to be thorough. We wanted them to really go into all the detail and investigate what had happened. But dates came, dates went. At the 8-month mark, we received our first kind of formal update as to what was happening. And that update was one bullet point that said, waiting on responses from nurses.
Jeez.
At 8 months after we had filed a complaint, or several complaints, which resulted again in the death of our child.
Right.
And a bullet point telling us that the nurses had still not responded to the complaint to the College of Nurses. So it's the process, the communication. We have now received 2 reports back. It broke our heart because it was worse than we thought. Their own words, their own investigations, their findings, and this is more or less word for word stated that there was a lack of knowledge, skill, and judgment, and that the members were a high risk to patient harm, that they did not understand, that they saw a deterioration, but they did not understand the severity of that because they lacked pediatric knowledge.
Right.
And I can't tell you how difficult that was to hear. But at the same time, after those words and their investigation and saying, that they were a high risk to patient harm, their decision was to do nothing.